Hello, INSURE Black America. I hope everybody is doing well. And so, in today's video, I'm going to be talking about um, what is Medicare supplement insurance. Okay. Um, so, for those who don't know me, my name is Katrice-The, and I am a licensed health insurance broker. I am licensed in 19 states, and my goal is to be licensed in all 50 by July 2021. And I am also the founder of INSURE Black America, where my mission is to close the coverage gap in healthcare between Black Americans and other racial groups. Okay. And so today I'm talking about Medicare supplement insurance. Like I posted earlier today, AEP, the Medicare AEP, which is the Medicare annual enrollment period, that starts September 1st, will be 45 days. Okay. And so it's important now that you start to take a look at your health needs and look and see, okay, what am I, my needs now currently. If you've had any changes to your insurance, to your health, you had to change medications or anything like that. Now is the time to start sitting down and looking at, okay, what has happened during the year when it comes to my health, and does my current health insurance meet my needs, okay? And so all this month we've been talking about Medicare, prepping. I've been prepping you guys for Medicare annual enrollment period. And so today, and I was talking about the different parts of Medicare. Okay. And so I want to talk about Medicare supplement insurance because when it comes to Medicare, to the open enrollment, you can go two routes. You can either go with a Medicare Advantage plan, which is a Part C, or you can go with original Medicare, which is Parts A and B. Okay, Part A is for the hospitalization, and Part B is for to see your doctors and things. And then you can get a Part D, which is your prescription drug, so that pays for your prescription drug costs. And then you can get a Medicare supplement insurance policy, also known as Medigap. Okay. And so now Medigap is basically a plan that fills in the gaps. Okay, it's kind of like gap insurance with your car insurance. Okay, so that 20% that you would owe, it covers those things. It also, some of the plans F and G, covers your Part B premium. Now there's different plans. There's A through F plans. Now I'm not going to go over each one of the plans and what they cover in this live, because that'll take too long. But if you are interested in it, you can always book a free session, and we can go over your needs and see if that is something for you. Now, what it covers is copays, co-insurance, and deductibles. Okay, so those are some of the things that it'll help pay for. You also have those that cover Medicare prescription drug costs. Okay, so before 2006, before Part D became law, Medigap is what a lot of people used to cover their prescription drug costs. Okay, now this just changed. So it changed this year with the 2020 year enrollment. And so as of January 1st, 2020, Medigap plans sold to people who are new. So if you were new to Medicare and you got a plan that was effective January 1st, 2020, okay, then your supplement is not allowed to cover Part B, the Part B deductible. Okay, so plan C and F. So if you were looking into a Medigap plan C and F, they're not available to you if you are new to Medicare. Okay, now if you're somebody who's been on Medicare before, if your effective date was before January 1st, 2020, then you can still get a Medigap Plan C and F. But if it's after that date, you're not allowed to, okay? Um, let's see here. So I'm going to give you 8 things to know about Medigap policies. Now, this is straight off the Medicare website. I don't have this memorized or anything. But this is straight off the Medicare.gov site. And so the first thing is you must have A and B, Part A and B, okay? So now, when you're talking about getting a Part D plan, you can get a Part D plan with just Part A. Okay, so you don't have to have A and B to get Part D. Now, in order to get a Medigap plan, you would need Parts A and B. Okay, now a Medigap plan is different from a Medicare Advantage plan. Okay, so with a Medicare Advantage plan, you can't have a Medigap policy. Okay, you either can have original Medicare and a Medigap, or a Part C. Okay, you can't have both. Okay, now you pay the private insurance company a monthly premium for your Medigap policy. Okay, now this premium is in addition to the Part B premium that you pay to Medicare. Okay, so you must, in order to get, and it's just like with a Part C, you have to have Part B. Okay, you must be enrolled in Part B in order to get a Medigap policy. Okay, and you pay that premium to whomever. There's multiple companies out there that where you can do the Medigap policies through, but you have to have both A and B. Okay. Now, the Medigap policy only covers one person. So if you and your spouse are both looking into Medigap policies, you each will need your own policy, and so you each need to pay the premium. You can't both be on one policy. Now, you can buy a Medigap policy from any insurance company that's licensed to sell one in your state. Okay? And any standardized Medigap policy is guaranteed renewable even if you have health problems. So basically that means that the health insurance company can't cancel you your Medigap policy as long as you pay the premium. So if your health takes a turn for the worst while you are covered and you're paying your monthly premium, they can't drop you because of your health getting worse. Now, some Medigap policies in the past, like I said earlier, they did cover prescription drugs. But now any policies sold after January 1st, 2006 are not allowed to include prescription drug coverage. And so you would have to get a Part D. And it's illegal for anyone to sell you a Medigap policy if you have a Medicare Advantage plan. Okay? Unless you're switching back to Medicare or Medicare. So if you have a Part C and you've done a health needs assessment and you've decided, you know what, this Part C just isn't working for me, I want to go back to original Medicare, you can do that. And then once you make your election to go back to original Medicare, you will need to get a Part D, and then at that time you can look for a Medigap policy. Okay? Now, if you're doing it the reverse and you're leaving original Medicare and you're deciding that a Part C would better suit your health needs, then you must submit in writing to the Medigap company, whoever your Medigap policy is through. You must submit in writing to them that you are canceling your plan, you want it canceled, effective date that you want it canceled, because again, you can't have the Part C and the Medigap policy. And once you enroll into the Part C, they're not going to alert your Medigap company to let them know that you've enrolled in a Part C. That's something that you must do on your own. And even an agent can't do that for you. They can only advise you, who to call or who to not call, but who to write in order to cancel that. Okay, and where you would send that correspondence to. Okay. And so Medigap policies don't cover long-term care. They don't cover vision and dental, hearing aids, eyeglasses, or private duty nursing. Okay, so those type of things would be covered in a Medicare Advantage plan. So if you want a Medicare Advantage, if you need those type of things, it may benefit you more financially to look into a Medicare Advantage plan. Because if you have a Medigap, you're going to have to get all of those coverages separately. Okay. A Medicare Advantage plan is not Medigap. Medicare prescription drug plans are not Medigap. Medicaid is not Medigap. However, if you are eligible, if you have Medicare and Medicaid, there are Medicare Advantage plans that will help you to coordinate your benefits and, all those things that you can get. But I'll talk about that on another live. Being dual eligible is what it's called. Medigap plans are not employer or union plans. They are not TRICARE. They're not veterans benefits. They are not long-term care insurance policies. And they are not Indian health service, tribal, or urban Indian health plans. Okay, so Medigap policies are strictly just kind of like gap insurance. Okay, they cover co-payments, deductibles, and co-insurance. Okay, that's the main things that they cover. And like I said, if it was before 2006, January 1st, 2006, then your Medigap policy may cover your prescription drugs. If you purchase one after 2006, they don't cover prescription drugs. Okay. And so when you first are eligible for Medicare, okay, so when you are within your first coverage, your initial coverage period, okay, which is 7 months, 3 months before your birthday, the month of your birthday, and 3 months after. Okay, so you get 7 months to choose whether you want to go with the Part C route or if you want to stay with original Medicare and get a Part D. Okay, and so you have your initial, when you first initial are enrolling, you can get on a Medigap policy. It doesn't matter what kind of health issues you have or anything, you can enroll and boom, guaranteed. Okay. Now, if it's after that, you can enroll in a Medigap policy at any time in the year. However, they will ask health questions if you're not in your initial enrolling period. Okay. So they will ask, health questions to see, and they're underwritten, so you may or may not get approved. Okay. Let's see here. That's pretty much it when it comes to Medigap. I just wanted to, because I know I've been talking about all the different parts of Medicare. I talked about Part C. The last live I did, I talked about Part C's. There are advantages to both, just depending if you're somebody who, you're needing dental work done and you're needing a hearing aid and you wear glasses. A Part C may be more beneficial for you because those services are included in the Part C. However, if you don't wear glasses, your teeth are fine, you don't need a hearing aid, and you just want, coverage to go to the doctor. If you have to go to the hospital, you want coverage. And then you want, just something to help you with the 20% that you would be responsible for. Then a Medigap policy with original Medicare and a Part D may be the better choice for you. Now, you do have to still pay your 20% with a Part C, but what you pay is considerably lower if you need those services versus what you would pay with an original Medicare. And so I hope you guys found value in today's live. If you did, please share it out so that others may find value. And also, if you have not liked and followed INSURE Black America, go ahead, give me a like, give the page a like and a follow. I don't go live. It's been picking up. I've gotten quite a bit of more clients, And so I haven't been going live twice a week, so I'm working to get back to going twice, going live twice a week. But however, I will go at least once. But if you have any questions about today's live, or if you have just any health insurance questions at all, you can either drop them here on this live, and I do check back, and so I will go ahead and I will respond to those questions. Or you can just book a free health needs assessment with me via the Book Now page, or you can go to INSUREBlackAmerica.com and you can book a health needs assessment with me. So I hope you guys have a great rest of your Thursday. And if you are watching this in the Texas, Louisiana area, my prayers with you with everything that's going on down there with the storm. I'm in Florida, so I know all about the hurricanes. So my prayers are definitely with you. And you guys have a great rest of your Thursday, and I will talk to you soon.